Welcome to Joy in Our Town. I'm your host, Lynette David, and we have a very special segment for you. I have in the studio with me Esther Flores, CEO and love warrior for the One Divine Line to Health. She joins us today to discuss Christ-centered care. Welcome, Esther.
Thank you for the invitation. I would like to first thank God for giving me an opportunity to be here to bring this message across. And secondly, I would like to thank Trinity Broadcasting Network and the team here in Central Ohio. They're doing a great job in trying to educate our community about the different forms of joy in our town.
Absolutely. Now, you're doing a lot of good work, not only locally, but globally from the medical standpoint. Why don't you tell us a little bit about what it is that you are doing, Love Warrior?
Okay. The first thing I would like to explain to our listeners and to the people who are watching is that love is the remedy, and that's what I use. Clinically, I am a nurse. I'm a registered nurse. I graduated from Ohio State University, was trained by the best. I've worked in different institutions from the hospital, nursing home, home care, different settings. The thing that I look at when it comes to Christ-centered care is using love as a radical remedy to heal people. How do we do that? Basically, what we do is we work with other professionals who are interested in the healthcare field and volunteering here locally and also internationally. That's what we do. And I call them love warriors, and I also call them compassionate messengers.
Right, I'm a love warrior
yes,
now.
You are. The team here.
You let me know, right, I'm a part of the family now. So from a medical standpoint, there is a great need. There's a great need that we address medical conditions, not just physically, but spiritually. And of course, you know, people that have emotional or maybe even psychological. So since you are a medical professional, not just a person with a good heart, you get a chance to address those things. So tell me what it would look like. What does that look like when you go to provide a service? How do you determine who you're providing these services for?
Locally here, there's two types of things that we have to look at: urban ministry and global ministry when it comes to healthcare. So briefly, what I can explain is, and I think we need to know this, over 15% of Americans here in the United States, it's been documented, have no health insurance. What does that mean? Translated to numbers, we're talking about over 40 million people don't have health care. And I've, in the past, been one of those people, okay? What can we do? Well, thank God there are nonprofits like myself. What we do is we run free clinics. You know, we work with free clinics. And what we try to do is the working poor, because there are people who are working, they just can't afford health insurance. We have homeless people. We have women who are also working the street. I call street walkers. They don't go to a hospital because they know if they go to a hospital, you know, clinicians are trained, you know, to identify them. And you know, and they need help, and if they don't want it, you know, there's a problem there. Or the pimps, they're not going to take them to the hospital. So free clinics are basically an opportunity for people to receive treatment but not to be judged. And that's what I'm focusing on. Even abroad, going to the villages, you know, and helping people even in the national hospital. I don't judge. And I think that that's really important, because sometimes, you know, as healthcare professionals, we get so much pressure and we get so overwhelmed with what we see. You know, take sometimes the stuff at home, and it hurts, you know, and we're human. We have a heart, we have a mind. And like you had mentioned earlier, you know, health is mental health, it's spiritual health, it's physical health. As a nurse, I was trained to look at a person holistically. So that's what it involves.
That's good. That's good, holistically. So what about, you said women, what about if a woman is pregnant and she needs the OB care? So how are you able to address that? You know, what about your medical supplies? What about prescriptions and, you know, all the legalities that go with the medical profession? You have doctors that you work with. Do you have a staff? You know, what does it look like?
Let me focus here on urban ministries. One of the things that you have mentioned, you as a love warrior, you're very involved in the community, you know. We know resources that we can refer women, especially young women who are afraid, you know, or They're involved in human trafficking. And I know that that's another topic in itself. But just for an example, she's out there, unfortunately, being sold, and she's young, and she has no place to go. Well, if I find a young lady in that situation, the first thing I'm going to do is I'm going to talk to her, and I will give her pregnancy decisions number. Okay. Why? They're a nonprofit. They're very credible in our community. They've been here for over 35 years, and those are the people that I associate myself with. People with credibility, people who are not spiritual vigilantes, you know, taking the name of God, you know, in vain, and then trying to cure people, you know, in the name of whatever, you know. As a clinician, we need to follow the rules.
That's right.
My rules, first of all, you know, my chief medical officer, his name is Jesus Christ, okay? Here in the state of Ohio, I have a board of nursing, and I don't do anything without, you know, the orders of a physician, you know, so I follow the rules.
That's good.
So as a clinician, as a nurse, what I can do is I can refer. You know, there's certain things that I can do. Yeah, I've been trained in first aid, but when it comes to being a physician, I make a referral, and I make a referral to free clinics or people that I know in the community. I'll give them a call, give them the scenario, then they tell me what to do. That's kind of how I work here in urban ministries.
I like that because some people think they're so radical, they're so fired up, and there really is a cause, there really is a concern, there really is an issue that needs to be addressed, but there's a decency and an order way to do things. And I just put that phrase together myself.
I love that.
I believe I know that we have to, just like HIPAA, you got to follow all the things and regulations and standards that go along with that. If not, you're doing more damage than good.
Amen.
And so the blessing is that you are a real clinician. And so you're not just the person with a good heart saying, let me go administer medication, or I'm going against the grain because I don't agree. It's not about my own personal opinion. Like you said, we're not judging. We're not looking biasly at anyone. We're addressing the need at hand like Jesus did.
Amen.
And like you said, there is a great need. There's a lack of people, you know, lack of care for a lot of people because they don't have medical care. So you're out there. So you're doing it. So you meet somebody. So that means that you're out. You're really literally out in the community. You're literally out there. You're literally out there on the streets. You're literally going into places that maybe somebody else might say, oh, I'm not going there, you know, or that's not my calling. And not only are you going there without fear, you're going there in the name of the Lord, but still as a professional. And you're following the order of what you took an oath for as a nurse. And so how long have you been a nurse?
It's been, I forgot, I think over 20 years.
Wow. Girl, you look like you're only 25.
No, I think 16 years, but I've been in healthcare for at least 25 years.
Okay, wow, wow. So you really love this. You love this.
Oh, I love it. It's my passion.
And the name of your organization again, why did you come up with that name? Like, how did you come up with that?
There were quite a few names that I was brainstorming. And the reason why it's called number one, divine, because I believe in a higher power. I believe in the mighty power of Jesus. And line, he's the only line. He's the main line, you know. You can just dial you don't even have to dial 1-800-JESUS. You just say, Jesus, help me, and he's there, you know. But one divine line to health is he's the access. That's the reason why. Okay, and I thought it would be catchy. It's catchy. It was catchy for me. Sometimes it's a little bit difficult because of the misspelling. But you know, one divine line was the line that I thought that it can help people here locally, nationally, and internationally.
Good, good. So you said you're a nonprofit. So that means that you have possibly sponsors or out of your own pocket or.
Well, that's been a challenge.
I'm sure. But if I believe that if God gives you a vision, he will give you the provision. And again, I like to focus a lot on not just saying, I want to do something, because you could want to do something, but it could be out of your lane. But you took the necessary steps to get the discipline and the discipline in nursing so that you meet the cultural standard to go ahead and address these needs. And you just kept, you know, your foundation in place. So how can people get in touch with you? Tell us, how can somebody get in touch with you? What if they do want to contribute? What if they want you to come and talk more about what you're doing and shed more light on this great work that you're doing for the community, addressing these issues? And how can they get in touch with you?
The first thing they can do is they can pick up a phone call. You know, just make a phone call, and they can call me directly to 614-313-0544. I also have a website, and people can take a look at it, and it's onedivineline2health.com. And one of the things that I'm really focusing right now is what we call the Love Depot or the Love Warehouse, where we can have multiple resources. For example, a med clinic, a legal clinic, a fitness center, a cafe, a worship center, which can also be used as an activity center, a daycare center, a life skills center, so that people who need a GED, can get a GED, or if someone needs a job placement, that would be the place. I work with social workers and other people that can also help people apply their life skills. They have them, they just need application or search their talents.
That's good.
On top of that, what's really important is what do we use as our love to captivate people.
Yes.
Our currency, you know what it is food, clothes, furniture, through Basement Blessing. That's where my best friend started an organization called Basement Blessings.
Yes.
Okay.
Yes.
And in my case, the medical supplies, the hygiene products that the hospitals and Veritiv donate, and other organizations that donate, because we can distribute some of the stuff here, but also nationally. Do you know that there are other states that are reaching out to me, asking for supplies, and abroad? I have Syria. I have people from Palestine, instant messaging me, India.
Wow.
So having the Love Depot is just not owning a distribution center, but people are going to be, they're going to see love and they're going to experience love.
That's beautiful.
That's why it's different,
That's
beautiful. And I feel that Central Ohio is the place. Our motto in the state of Ohio is with God, all things are possible. Where did they come up with that?
Right.
Came from the Holy Book.
That's right. That's right. In the heart of it all.
Yes.
And we're getting ready to wrap up, but sure. I love how you said you have to have something for them, because it's one thing to go and catch the fish.
Yes.
But if you don't have anywhere to take them and clean them, then they stay on the boat and die and stink. And it's nasty. And so we want to catch, and a lot of us are coming up with these ways to get them to help the people. But once I help them and I draw them in by God's help, I have to have necessary tools in place, so that I can get them and help them be disciplined to get where they need to go after they leave me, So that's beautiful. I love that. So this is wonderful. And thank you again for joining us. We have got to have you back.
Please
and why don't you give us that number one more time? You ran through that phone number so quick.
Okay.
Just in case somebody didn't get it. I know that we'll have it on the screen or what have you, but why don't you give us that phone number one more time in case someone wants to write that down?
Sure. It's 614-313-0544.
Amen. It's been a wonderful, wonderful segment just sitting here talking to you. Very informative. Just a reminder of how it's so important for everybody, whatever your profession is, to use that to help someone else. So that's awesome. Thank you again so much for coming.
Thank you. Agape.
Yes. Coming up next, human trafficking. Stay with us. We'll be right back.